I'd like to introduce now Dr. Alex Wodak, who is a physician and chair of Australia 21. He helped establish the first needle syringe program in 1986 and the first medically supervised injecting centre in Australia. Dr. Wodak.
Good evening, friends. Can I begin by reminding you of the first words our new Prime Minister said a month ago when he was introduced on live television by Senator Wong, and he said the Uluru Declaration will be implemented in full. Wonderful. The question before us tonight is it time to legalise drugs? This is being asked now because the international drug control system is clearly and irretrievably broken. We all know it, and we've known it for a long time, that the harms of drug prohibition far outweigh any benefits. We know it doesn't work for two reasons. First, because the world drug market has been steadily expanding and getting more dangerous for many decades. There are now larger quantities of an increasing number of different kinds of drugs, and with the more recent drugs being more dangerous than the older drugs. Second, and even more important, we know conventional drug policy doesn't work because deaths, disease, crime, corruption, and violence have all been increasing for many decades. There were only 6 heroin overdose deaths in Australia in 1964, and over 1,800 drug overdose deaths in a recent year in Australia. Gramsci said, "The old is dead, but the new is not yet born." So why does this dysfunctional approach continue to survive if it has failed so abjectly and is so futile? It survives because it worked for a long time as a political strategy, even if it had failed as a policy. But things that can't go on forever don't. So the old system is slowly dying, and it will continue to die slowly until it starts to die quickly. Social policy reform is usually painfully slow and then often speeds up. Martin Luther King Jr. reminded us that, quote, "The arc of the moral universe is long, but it bends towards justice," end quote. How will the drug law reform process end? We can be very confident that it will not end with all drugs being readily available to whoever wishes to purchase them in whatever quantity. If that's your definition of drug legalisation, then drug legalisation is never going to happen. No one wants to see 1 kilogram bags of 100% pure heroin or cocaine sold at the supermarket checkout. We have to be mindful that the market for what are currently called illicit drugs is subject to both powerful economic and political forces pulling in opposite directions. At present, the political forces dominate, thereby ensuring that the major league drug traffickers earn obscene incomes. But the lucrative profits of drug traffickers undermine the political forces supporting prohibition. The political forces have been in retreat slightly in recent decades, so that some previously illegal drugs are now starting to be regulated by the state. The process arguably began in the Netherlands in the 1970s, then spread to Switzerland in the 1990s and Portugal in 2001. It continued with Uruguay becoming the first country in the world to regulate recreational cannabis in 2013. Then Canada began regulating recreational cannabis in 2018. Social policy reform often begins in federated countries at the city or state level before the national level adopts the reform. This has certainly happened with drug law reform. In 2020, 58% of voters in Oregon in the United States supported scrapping sanctions on the possession of personal quantities of all illicit drugs. This is particularly significant because the United States was the main instigator and the main enforcer of the international drug control system from its very beginnings with the 1909 Shanghai Opium Commission. And the US intensified drug prohibition when Nixon turned a policy into a political strategy in 1971, helping Nixon to win 49 of the 50 states in the 1972 presidential elections. An international drug law reform process is now underway for certain, if it's definitely happening in the United States. The center of gravity of the system will shift from an unregulated market towards but never reaching a fully regulated market. Drug markets often have unregulated and also regulated sectors. Australia has never managed to extinguish an unregulated supply for tobacco, which is now readily but expensively available legally from 20,000 outlets, with the black market accounting for possibly 20% of total supply. So whatever is decided about legalising cannabis, amphetamine, heroin and cocaine, rest assured there will always be some black market supply, however, a much smaller proportion, hopefully, than we have today. Pharmaceutical heroin, or diacetyl morphine, is now provided for self-administration by injection under supervision with intensive psychosocial support as a treatment for a small minority with very severe people who have very severe problems and who also haven't responded to previous treatments in about half a dozen countries. This was the trial that Australia was officially officially recommended in Australia 41 years ago, and that the Howard Cabinet mistakenly stopped from conducting 25 years ago, almost 25 years ago, on the 19th of August 1997. Research shows that many improve substantially from this treatment and that the illicit heroin market appears to shrink in those countries. What this treatment tells us is that street heroin results for some in severe problems, also problems for their families and their communities. But pharmaceutical heroin, provided in the manner I just described, provides significant benefit to the same people, their families and their communities. This means it's the unregulated supply system which is the real problem, not the drug itself. Black markets are nasty, pernicious and insidious. They spread corruption in our legal systems, financial services, courts and judiciary, real estate services, banks and politics. The problem is much worse in low and middle income countries which are involved in the production and transit of illicit drugs such as Afghanistan, Pakistan, Colombia, Peru, Bolivia and Mexico. And sometimes the serious problems in these countries come back to harm rich countries like Australia. It's time to start a process of legalising drugs, but we must remember all of these caveats. The regulation of recreational cannabis in Australia is now inevitable, just a matter of time. This is likely to be followed by the regulation of MDMA and psilocybin, which are also low-risk drugs. It's important to start with the less difficult drugs first and leave the more difficult drugs for later. It's also important that this reform process is not rushed. Most enduring political change is evolutionary rather than revolutionary. Methadone treatment for people with serious street heroin problems began in Australia in 1969. It's been a great success. But methadone is a compromise. People who like street heroin aren't all that keen on methadone as a treatment, but accept it in the same way as the community is also not all that keen on methadone, but accepts it as a way of minimising deaths, disease, crime, corruption and violence. We need to find other compromised drugs like methadone that we can all live with and where some of the lowest risk versions can be provided at retail outlets. The system we end up with is likely to be somewhat unstable and subject to frequent revisions. Prohibition doesn't prevent drugs the majority dislike from being available. It just ensures that some of the unregulated supply of these drugs is provided by some pretty nasty criminals. The more intensively drug prohibition is enforced, the more dangerous the street drugs become. As Emma has just reminded us, on the 22nd of March 1999, the then member for Grandler, still the member for Grandler, the Honourable Anthony Albanese, said in the Federal Parliament, quote, "Drug dependence is a medical, not a criminal problem, and the community is prepared to explore as many ways as it can to deal with this problem," end quote. It's time now to start implementing these fine words. Let me leave you with a quotation from Frances Hodgson Burnett over 100 years ago, who said, at first, quotes, "At first people refuse to believe that a strange new thing can be done. Then they begin to hope it can be done. Then they see it can be done. Then it is done, and all the world wonders why it was not done centuries ago." Thank you very much.
Drug Policy Australia is a fully tax-deductible charity. If you'd like to help save our young people from the harms of prohibition, please visit the donation page on our website. Thank you.